As our country continues to battle this second wave of COVID-19, we've seen several provinces take on stricter measures trying to reduce case numbers. In the meantime, our vaccine rollout is not keeping pace with the number of cases that we're seeing. So, joining us with a look ahead this morning to some of our COVID-19 markers for 2021, we are joined by infectious disease specialist at Sinai Health and University Health Network, Andrew Morris. Good to have you with us this morning, Doctor.
Morning.
First of all, let's talk about this post-holiday surge. We've seen this through every sort of long weekend and holiday in this country. We know that the numbers are going to go up. Quebec and Ontario are two such provinces that are facing this post-holiday strike, even before the lockdown went into effect. So first of all, when will we see the end of the holiday spike?
Well, I'm hoping we'll see the end soon. It won't be soon enough. It would have been great if we saw the end of it yesterday, but it's probably going to continue for at least another couple of weeks. We start to see it about a week after people start gathering, and then it will continue on for a few weeks after people have been, getting in close contact with each other. So we've probably got a few more weeks of this at least.
Yeah, that's interesting because typically it sort of follows a 2-week pattern, but we're now 3 weeks after Christmas, and we're still seeing the numbers climb. Why so much longer this time?
Well, I think there's a few things. One is that people don't only gather on Christmas, even though the guidance was to only gather up until Christmas, but I think people were most likely gathering after that. On top of that, there are a lot of people who, out of necessity, are working and are in close contact with other people. And so we're still going to continue to see cases from people who are in workplaces and are being exposed to other people. And then I think the other, unknown is the role of these new variants that may be a bit more contagious. And so that may just increase the duration and the height of the spike that we're experiencing right now.
Yeah, and that variant is what's driving the third wave in the UK right now. Recently, the WHO, back in November, warned of the third wave. And what I thought was interesting is while they praised Asia and Asian countries for their response, saying they understood how to get the numbers under control, they chastised Europe and it said their response was incompetent. They didn't understand that the virus had to be tracked exponentially. So when we apply that here in Canada, what can we learn to reduce the third wave and the effects of the third wave?
Yeah, it's been kind of inexplicable. We're likely going to be following the European experience. My guess is what we'll see is most provincial governments relaxing restrictions as this second wave goes down too early. And really in short order, we see a third wave. And that's what we've seen, as you mentioned, in Europe. And we're going to almost certainly experience that. That's probably going to be sometime towards the end of winter. It will really depend on when governments relax their restrictions.
Is the third wave worse than the second wave in terms of cases and deaths?
I think it's unknown, to be honest with you. I think we're in a bit of a race against time with vaccines. So the more vaccines we can get in arms, especially more vulnerable people, the less we'll have in terms of deaths and severe sickness. So it really is a fine dividing line there.
All right, if we're looking at a potential third wave hitting at the end of winter, what can you tell us about the rollout for the vaccine? We know that we're in tier 1 right now, but when can we expect the rest of the population to start getting their shots?
Sure. So at the moment, clearly the focus is on people in long-term care, retirement homes, and frontline healthcare workers, especially in acute care, so in hospitals. We'll see that continue on till, the end of winter. As we get closer towards the end of March, and then we go into April, May, and June, we'll start seeing that roll out much more broadly. Teachers, other frontline healthcare, and older adults, with the focus on getting as many community living older adults as possible. And then if we're lucky, we make our way quite well into the late spring and then summertime, where the rest of the population should be able to be vaccinated. If we get those vaccines, which we're anticipating, and if we can actually operationalize that.
It's always unsettling to hear the words if and luck when we're talking about dealing with this global pandemic. It is good to have these markers, at least as a guideline. Dr. Andrew Morris, great to talk to you this morning.
My pleasure. Thanks so much.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.